is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I am joined by Dr. Cecilia Disney, a new provider with Northwestern Primary Care and Northwestern Georgia Health Center. So welcome to our community.
Thank you. Thank you for having me.
Yes, well, and it's great to have you on the show. It's always wonderful to introduce new physicians to the community so they get a sense of who they'd like to be seen. We want everybody in the community to have a primary care provider. So it's great to have you here. So start off by telling the community a little bit about yourself, who you are, where you're from. It's a little bit about yourself.
Well, I grew up across the lake in the Adirondacks, so I'm not a Vermonter by origin, but not too far away. So we grew up in a small town called Willsboro, New York, which is just across from like Shelburne, Vermont.
Ah, okay.
So yeah, when we were fussy kids growing up, my mom would put us on the ferry between Essex, New York, and Charlotte, Vermont, and we would go back and forth. Yeah, we rode that ferry far too often, probably, but so we would just split passenger and ride back and forth. So we came over to Vermont a lot. Burlington was our big city growing up, right?
Yeah,
and
sure.
so it was the big city where we would fly in and out of, and so that's where I grew up. And my dad is also a primary care physician, and he still practices. And he practices right now in Plattsburgh, New York.
Okay,
so
nice.
Literally just across the lake. So, yeah, and I have two younger sisters, and yeah, it was a beautiful area to grow up in the Adirondacks. We always thought our views looking over to Vermont were beautiful. Though I have to say, now that I'm on this side, I really enjoy the views.
It's
looking back the other way.
I do.
Oh yeah, it's really nice.
It's really beautiful.
Nice. Yeah.
Yeah, so what's not to like? It's amazing, and to be so close to your family.
Yeah.
So you're on
really
the other
nice.
side of the ferry, right?
Exactly. But I can still ride the ferry back and forth if I want.
I love that story. Yeah. So is this your first practice setting or in St. Albans, or have you practiced in other locations?
Well, I did my medical school training down in Philadelphia at the University of Pennsylvania, and then matched in family practice residency out in Seattle, Washington. I kind of wanted to explore a new area, and the Northwest, there's lots of areas that are really strong in family practice training, but I really liked kind of the philosophies and some of the programs that I interviewed out in the Northwest. So I matched at a program in Seattle, and then after I completed my residency, I stayed out there for 5 years to work. And so I worked at both, my main setting was CMAR Community Health Centers, which is a community health center serving all patients from all walks of life, just south of Seattle. And then for a while did hospital work at a Swedish hospital in Seattle. So I've been in practice for a bit now. So worked out there for 5 years before coming back this way.
So the timing was right to come back, or what called you back?
Well, I had promised my family right after residency I'd move back, and I kind of broke that promise a little bit. Seattle's a really lovely place to live. So I've tried to convince them to move out towards me, but that they were kind of resisting. Sorry, excuse me, I have a cold. So
sure, yeah, sure. 'Tis the season.
But we were really missing the Northeast, and we were lucky enough to have a healthy baby born about a year ago, in December 2018.
Nice.
Yeah. So with the little one in the picture, family was even that more important. So we decided, it was time. And when I was on maternity leave, I came back and interviewed at locations in the Northeast to move back.
And you selected Northwestern Medical Center.
I did, yeah.
Yeah. What was the draw?
Well, I actually, excuse me, there was a few different reasons. Sorry, now I'm losing my voice because of the cold. Hold on one second. Excuse me. So there was a few different reasons. I loved the area. And when I came to Northwestern, I first met the recruiter who was just incredible. And so she was my first point of contact, and I thought, this person's just amazing. And then I got to meet the people, and on my interview day, I really enjoyed the people that I met, both administrators and then my physician colleagues, and was looking also for a place that had strong female leadership. So I was excited to see a lot of women like yourself in leadership at Northwestern. So that was a big draw for me as well. And I just got the sense that this is a community, one that really needed more primary care physicians.
Definitely.
And that, my family would enjoy living in, and I'd have colleagues that, I'd enjoy working with. And then there was the added bonus that my sister, who was an OBGYN physician, had signed a contract to join you all a few months prior. So it was a bit serendipitous and icing on the cake, if you will. So,
oh my gosh.
yeah.
It was so fun describing Liz Disney and Cecilia. You're trying to, yes, they're sisters. Isn't this exciting?
Yeah, our last name isn't super common, so having two of us the same name is interesting. But people asked if it happened on purpose, and it was actually somewhat accidental. I never dreamed that the place she was looking would also have an opening for me. Right. So I actually was a recruiter who recruited for me for another job, told me about the opening in St. Albans, and when she's mentioning the job, I was like, that sounds really familiar. I think my sister may be looking there. So, excuse me. So, anyways, it was a bit serendipitous. Yeah.
Yeah, it's really been fun, and then to have you both here now, you're definitely all that you presented. You both just have this great spirit about you and the love for your patients.
Yeah, thank you.
That's terrific. So what's your practice like? Now, you're at Northwestern Primary Care and Northwestern Georgia Health Center. So tell us a little bit about your practice here and how it's evolving, what you'd like to be doing with it, and the type of people that you want to see.
Yeah. Well, right now I'm at two different locations. Northwestern Primary Care, located in kind of the main hospital building up in St. Albans, and then I'm also located in Georgia Health Center, and I'm a 50-50 split, so I'm found in both spots.
Okay.
And I love taking care of patients of all ages. I love doing procedures. So more specifically, like I see, newborn babies. My last job, I probably had 2 or 3 newborns a week that would join my practice. So we were a high volume pediatric practice at my last job. So I really enjoy seeing kids all the way up through, middle age into our geriatric population.
Okay.
So I find it keeps things really interesting throughout the day to see a wide variety, to see a 3-day-old baby, then I see, an adult person with diabetes, then I see a woman for her well woman exam and do her pap smear. So I like the variety throughout the day. I also trained at a location and worked my last job where I wanted to provide the best possible care that I could to every patient and walk through the door. And I, obviously feel that same way. And if they need a procedure that day, I like to try to do it that day. So if there's a mole they're worried about, do the skin biopsy that day, just remove it and get some pathology on it. If I need to, refer them to the dermatologist if indicated. So I really enjoy trying to incorporate different things into my practice. So I've been starting to add on different procedures at both locations, from joint injections, skin biopsies, women's health procedures, birth control, things like that. So it's been fun to start to incorporate that as well.
That's terrific, because it sounds, as you're coming in and younger folks are joining our team, they're bringing back procedures in the office. I really like that, and really taking care of the whole patient as best as possible.
Yeah.
So that's wonderful. Is there anything about the population, now that you've been here a little bit, anything that surprised you, or any insights or anything you want to share, or like, wow, I didn't realize this, or wow, this is a surprise to me?
I think the biggest surprise when I came to Vermont was I didn't realize what a shortage we had of primary care physicians in the area.
Yes.
I know it's a nationwide issue, but I think of Vermont, being on the forefront of a lot of things with healthcare, and so I was like, oh, they have got lots of primary care physicians, but I didn't really quite realize the shortage that we have. So that was a surprise to me, and definitely kind of instilled the drive to continue to try to mentor people thinking about going to health care, to encourage them to go into primary care, because it's definitely needed everywhere. It was needed where I was out in Seattle, and it's definitely needed in this area. So that definitely surprised me. I think in terms of the patients, the hardy Vermonters, definitely true. And I've been just really impressed and in awe of the resilience of a lot of the patients that live in the area. And it's been like a pleasure to get to know them so far, and I really look forward to continuing to get to know them. I spent 8 years at my last job between residency and staying on afterwards, and my favorite thing about my last job was getting to know those patients, and it was really hard to leave them. And so I'm so excited to be back in an area and kind of building that kind of continuity back up and getting people to having people know me and getting to know them and seeing them, whether it's for like their routine diabetes visit or an acute care visit because they have a cold. I like to try to see my patients whatever possible, and then if needed use our urgent care emergency room colleagues. But I really like trying to be there for whatever their needs might be in that moment. So. But yeah, I've been really impressed by the population in this area. So I would encourage people to come to the doctor more than once a year on occasion. I do have see a lot of patients who have a fair number of health issues who just come in once a year. Maybe it's a far drive or maybe the weather. But I definitely like to see people more often than that if they would like to come in. So, but yeah, it's been a really amazing experience.
That's super.
Yeah.
That's super. You think about the array of physicians and the advanced practice providers that we have that make this up, and really primary care is a centerpiece. And I think that's one of the reasons that there is more recruitment, because there was a time where folks could go primary care in the ED, for example, or there maybe their OBGYN and so now primary care is really the centerpiece. We want everybody to have a primary care practitioner. And also, when you think about, it's different to practice now.
Yeah.
All the documentation, the electronic health record, for example, is supposed to ease your practice, which to me sometimes complicates it more. Yeah. Even though there's interconnection, it's still, there's more for you to do than see the patient. So you probably can't see as many patients as you might have been able to see years ago because of all of the requirements. So tell me, when you go to medical school, how do you choose family medicine? What drives you? Because there's so many opportunities, right, to be a physician. So did you always know you wanted to be like your dad, or were there other things that you considered to get to your path? So how do you settle on a profession when there's so many options? Yeah,
that's a great question. I'm not sure if we have like the 3 hours to do, but I'll do my best. So
a couple minutes.
So when I was little, I wanted to be in finance and like run the Disney Corporation, right? And so I had this pipe dream for a very short period of time. And then when I actually went with a group from Plattsburgh, New York, down to Central America to do some volunteer work when I was 17 and 18. And I mainly helped translate because I spoke Spanish and English, so I helped translate for the doctors who went down, one of whom was my father. And it was through that experience that I was like, wow, these, they just like, just like here, there's, and even more so there's a severe shortage of physicians. So seeing that and seeing how the need and wanting to be able to help those patients myself, that's kind of where the drive started. And then in medical school, I still wasn't sure about specialty. I think very few people going to medical school actually stick with the specialty they start off saying they're going to do. Okay. So it was a little bit of just figuring out, doing different rotations. I knew eventually I'd want to do either rural health or global health. So I wanted to have the training to be able to provide care in a variety of settings and do like kind of broad spectrum care, like kind of all encompassing care. And so family medicine really felt like I would be able to accomplish that goal. Wow. Where I'd have to know a lot about a lot, which is challenging and wonderful and hard all at the same time. And then also know enough to know when I don't know, and then, getting someone to the specialist who can answer the question, whether that's me making a phone call, getting the patient into their office, et cetera. So I think, family practice is a challenging field in that way because there's so much to know. But it also, is really fascinating, and I find it really interesting, and I get excited learning about new things. I was always a science nerd, so that's persisted into my adult life, and I think has served me fairly well in that respect. So, but I think that's kind of the short answer to the long,
I love it.
life
Thank
journey.
you.
Yeah,
That was really, really cool.
yeah.
So our time is coming to a close,
Okay.
but maybe just in wrapping up, what do you do for fun, or a little bit, just a little
Yeah.
pearl about you?
Well, probably my favorite hobby is cross-country skiing. I love it. So that was also a drive to move back to the
Yeah,
Northeast.
great.
So I was really excited about the snow this morning driving in.
Yes.
And we have the little sled that hooks up to my waist for the baby,
Oh,
and so
nice.
I'm taking her out on that, and I'm gonna do my best not to fall with her, the sled behind me. And we also have 2 dogs, so we love all outdoor activities that involve our
Fantastic.
dogs. And we love exploring the outdoors, like many people live around here, and spending time with family and friends. And around here it's really nice. You have the lakes, you can go adventure on the lake. You have the rivers, you have the mountains. So, but probably cross country skiing is where we spend the bulk of our time. So we're really excited to have more snow cover.
Yes.
I know not everyone feels that way, but I find like half my patients are excited about the snow, and probably the other half are dreading it a little bit, or they fly south to it. But we won't be flying south anytime soon. We're excited. We're snowbirds, so to speak.
Excellent, excellent. Well, that's fantastic. Thank you for that, and thanks for spending some time with me.
Thank you for having me. And sorry again about the cold.
It
happens.
It was perfect. Tis the season.
Yeah, exactly.
Great. Well, thank you for joining us today to learn a little bit about Dr. Cecilia Disney, who you can find at the NMC campus at Northwestern Primary Care, or in our Georgia location at Northwestern Georgia Health Center. So thank you for joining us today.